Good morning.
Good morning.
Thank you very much for coming, and welcome to another presentation, third presentation in the series. We are going to continue our conversation today on the topic of health equity. But before I go any further, let me tell you how this is going to proceed. I'm going to give you some welcoming remarks, and we will ask our panelists, of course, to introduce themselves, and we will bring Dr. Leah Alexandra to come and recap some of the discussions that we had the last time we set this whole conversation on stage. And after that, we will bring in Chris and Ms. Teresa Thomas, I believe, who will present for us a case study. And after that case study, we will bring our own Dr. Bill Cooper, who will lead this wonderful panel of experts to discuss this topic. And then after that, we will provide time permitting, of course, time for questioning, and then we'll have some highlights. But again, let me tell you again what the focus of today is in terms of the topic. We are going to focus on solving a public health dilemma in health equity. This had been the topic since the last time. Our focus today is on women, children and infant program, WIC specifically, of the Metro Public Health Department. So here are our objectives. We hope that all of us who are participating in this will be able in the end to discuss approaches to needs assessment and data analysis in public health programs. It is also our hope that we'll be able to identify ethical and other dilemmas in public health practice and recommend appropriate actions when we face those dilemmas. We hope further that we will be able to articulate the association between poverty and social injustice on one hand and health outcomes on the other. And finally, that we'll be able to describe public health guidelines towards equitable distribution of health services. At this point, I'm going to ask our panelists just very briefly, tell us who you are, and maybe tell us something that you've done lately that you're so proud of. We only have 10 minutes to do this. We can start.
Go ahead, Tene. Go ahead. My name is Barbara Clinton. I live in South Nashville in the Woodbine area. And I went to yoga this morning.
I'm proud of you.
Proud of that. Okay.
I'm Mike Hodge. I work for the Neighborhoods Resource Center. We're a nonprofit that helps neighborhood organizations in different parts of town. And something I'm proud of has nothing to do with work, but one of my sons got married, and I sang in the wedding and actually made it through it. So didn't forget the words.
Good morning. My name is Tene Franklin. I am a genetic counselor at Meharry Sickle Cell Center, but I live and work in North Nashville. Something that I'm proud of this morning really is just getting out of the house with 2 little ones and a husband. But it's great to be here this morning.
My name is Bill Cooper. I'm on faculty at Vanderbilt, and I direct the Vanderbilt Master Public Health Program, and have been privileged to be a part of the team sort of planning this workforce development series. So one thing I'm proud of is that we're doing this session today. And I'm excited about it. I think it's going to be a great opportunity for us to not only think about this particular problem, but then to think about models for how we might engage our communities in addressing public health problems moving forward.
I'm Samantha Pyle. I have a marketing communications firm that I started about 1.5 years ago called Green Apple. And I'm here to hopefully answer some marketing and communications questions for you guys. And how to enter this into the community. Something I'm proud of, I ran the Hard Rock Half Marathon on Saturday, and I ran it with Team in Training for the Leukemia and Lymphoma Society in honor of my mom. And I put her on FaceTime, and she crossed the finish line with me from Texas. So it was pretty cool.
My name is Teresa Thomas, and I'm the Nutrition Services Director with the Metro Public Health Department, and WIC falls underneath my area. And one of the things that I'm proud of is that I have an 1.5 acre yard with 45 trees, and I got the last leaf raked and put this weekend and put into a compost pile so that I can make compost for next spring for my gardens.
And my name is Chris Taylor. I'm the Bureau Director of our Community Health Division. The nutrition services are in my area. And I'm proud of my daughter finally getting into college. She's in Baylor, and we're done with that process.
Thank you all very much wonderfully. As I promised earlier on, I'm going to bring to the podium Dr. Leah Alexandra from Meharry Medical College. Now, for those of you who were present during our last presentation, she was the one who delivered that presentation. And she spoke about health equity and why it's so very important. And trust me, we had a very vibrant discussion at that time. We're going to bring her to the podium to just recap some of the issues that we talked about, so that then will form the basis of our conversation, and Dr. Bill Cooper will take it from that point. Dr. Alexander.
Good morning, everyone. So I won't take up much time, but I thought it would be nice just to do a quick recap. Perhaps there are people in the room who weren't with us last month, or a few months ago when we discussed health equity. So we started out by just looking at some different definitions of health equity. So here's one from Healthy People 2020, achieving the highest level of health for all people. Health equity entails focused societal efforts to address avoidable inequities by equalizing the conditions for all groups, especially for those who have experienced socioeconomic disadvantage or historical injustices. Another definition that I found on the internet, health equity is achieved when every person has the opportunity to achieve his or her full health potential. No one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. And finally, the definition from Margaret Whitehead, differences in health which are not only unnecessary and avoidable, but in addition are considered unfair and unjust. So if we had to think briefly about health equity, of course we know that there are several definitions for this concept. We've briefly looked at 3, but I mean, if you were to Google it, you would find several different definitions of health equity. But there are essential elements across all of the definitions. Of course, this thought about things being unjust, unnatural, perhaps avoidable differences in health status, and this distribution of disease and mortality rates across population groups. So those are similarities that we would see regardless of the definition that you kind of tune into. Health equity, usually we come to the table with the belief that things are beyond the control of the individuals that are being impacted, and that the problems are really systemic, okay? Individual choices, of course, are important, and we know that they influence health, but the patterns across populations are not a result of just people making bad choices or doing things that aren't in the not best choices for their health. So also, health equity is usually sustained over generations. So one of the things that I think was very powerful from our discussion last time was this graphic that, again, I found on the internet. And it really kind of brings to bear what health equity does in our communities. So think about instances where health inequities are high and community assets are low. Health outcomes are the worst compared to our tree, where we really see things flourishing, where health inequities are low and community assets are high and health outcomes are better. So take a few minutes just to look at the differences in the trees, the differences in the roots of the trees, because that's really how health equity functions in our communities. When we have high health inequity, really we begin to see health issues overtake the tree, and we have a situation where we can't sustain growth. Our communities look very different. So I think if we took a minute to think about even areas here in town, right, parts of Nashville, where we know that community assets are high compared to other parts of town where we know that community assets are low, and how inequities kind of play a role in each of those societies. Okay, so just again, something to think about and recapturing some of the things that we discussed from our first session. So as we begin to move forward in our session, I also thought it would be useful just to take a brief look at where we started with the case, because this is a wonderful opportunity because the health department has continued to work on this issue. So part of our discussion today is going to be kind of a highlight of where we are with this issue and some of the health inequities that still need to be addressed as they make the decision that's going to be best for the community and also best for the health department. So we started out talking about this issue of food insecurity and nutritional risk in South Nashville. So if you all who attended last time remember, we've seen a changing population. So between 1995 and 2010, there's been an increase in WIC participants in South Nashville. There's been a shift in demographics in South Nashville. Fewer African American participants, but an increase in the number of Latino participants. And also, the health department had experienced challenges in providing services to families in most need. So based on the case, we know that there was a discussion about possibly putting a WIC clinic in one of the mall spaces at Hickory Hollow, right? And challenges and needs of the clients that are served by the WIC program in this area were certainly transportation. I mean, if people, Nashville natives, Nashville is certainly a growing town, but it's not like it's a city where you can just get around if you don't have a car. So WIC participants were experiencing challenges related to the distance to these available services, and also public transportation is getting better, but still it could be even more better for people who don't have automobiles. There were also challenges with culture and language, and you can understand that as we see an increase in the number of Latino individuals that were accessing the WIC services. Then there were also challenges with federal WIC program regulations. So there are rules about what a WIC site can look like and where you can put them and all of those things. So that needed to be kept into consideration as well. And then finally, and this is a place where a large part of our conversation landed, was this sort of community pushback to expanding those services to that mall location in Antioch. And I will go ahead and say that I think the health department was a little bit shocked that there would be such a pushback, especially when, at the end of the day, I know that the people involved felt like they were doing something that was really going to benefit the community who needed to access those services. Okay? So that's kind of where we started with our conversation last time. And so fortunately, we have a wonderful opportunity to hear from the health department with regard to this case to kind of be provided with an update. So Chris, if you want to come forward.
I wanted to take just a couple of minutes, a couple of slides, just to kind of introduce everybody to the WIC program to make sure everybody's on the same page with this. As you know, the WIC program is a USDA supplemental nutrition program, and it's all about trying to eat healthy, eat right, stay healthy. It's really to learn more about nutrition. And really, if you look at what the goal or the mission of the WIC program is, it's really to safeguard the health of its participants. And that kind of gets to the whole question of health equity. What are we doing to try to, help people reach their full health potential? And so some of the main things the WIC program provides, certainly it provides, good nutrition to kind of just help people eat right. And it's a supplemental nutrition program. It certainly doesn't cover the needs of everybody has. There's a huge component of nutrition education, and we certainly want to help people to learn how to eat right. There's a component about being sure that people are referred to needed services, either health services or social services. And then one of the things that we really stress as a program is support for women who are breastfeeding. And we put a lot of effort and a lot of oomph into making sure that that happens. And of course, the outcomes that we're trying to reach with the WIC program are, just health outcomes. We're trying to reduce low birth weight. We're trying to prevent prematurity, decrease infant mortality, and just really improve both infant feeding practices and practices for women as well. The WIC program is a federal grant program. So every year Congress allocates a certain amount of money for that year. It's not really an entitlement program where anybody in the world who was eligible would have funding. So there are some guidelines that we follow. We do look at clients for both nutritional risk and medical risk. Women who have a greater risk or a higher priority, and we try to be sure that they get on that. And then, of course, there are income guidelines that we follow as well. The WIC program is 185% of the federal poverty guidelines, and I put up a graph to just kind of give you an idea of where this is. So you can see that a family of four making $43,568 a year would qualify for WIC. So again, it's not just a lower class program. If you look at WIC participation across the United States, really more than half of the women that deliver in the United States are eligible for the WIC program. And that's similar to what happens here in Nashville. I think we have about 52% in Nashville. So again, it's a very robust program. So the issue that we have as a department is we do have capital in our budget for 2013-14 to expand WIC services. And so we try to look at it, again, programmatically. What can we do that's going to have the biggest impact? One of the things we did last year is we created a mobile WIC program, and it's been very successful in making it easier for our participants to get their WIC things. So what we do as a health department, and certainly Dr. Paul likes us to use data to make our decisions, is we have created kind of a data-driven process to look at this. And we've created some maps to kind of look at where our clients are coming from and to figure out where best we need to put our services. And this kind of brings up an issue of how WIC is set up right now in Nashville. And Teresa, do you want to just say a couple words about that?
Currently in Nashville, we have 4 brick and mortar clinics. And those 4 clinics are primarily in the hub of the city, but our participants are not in the hub of the city. Our participants live in the spokes out into the community. So that does present a challenge for us to be able to provide services in the areas in which our participants live. We also go to the hospitals. We do bedside service in the hospitals, so we're able to reach all of our participants in the community whenever they are having their baby in the hospitals. But so that's primarily what we're looking at, is to see about taking the WIC services from the hub of the city expand more out into the areas where our participants live. We have our WIC budget each year is about $4.5 million, so we're very large, and we provide services to over 30,000 people in Davidson County. And that's what we call unduplicated count. They come to us at least one time. It's over 218,000 in a year's time if you take all of them that come in for each time they come into a clinic to receive services.
So what we did is, again, to kind of look at where our clients are at, we did these spot maps of where our participants are coming from. And I'm going to show you a couple of them and so kind of give you perspective on how we arrived at this decision. This is the Woodbine Clinic, and you can see that the Woodbine Clinic is located right there in that little red dot. So each of those little gold dots represents where a client lives. So you can see that, again, the majority of the clients that go to Woodbine live along that Nolensville Road, Murfreesboro Road area out into Antioch. This is our South Nutrition Clinic, which is also located very similarly in that same area. But you can see that the clients are maybe a little bit deeper into the Antioch area. But still, the majority of the clients are coming from that location in town. These other dots, you can see the purple dot is our Lentz Clinic, the kind of teal dot is our East Clinic, and then the dot up at the very top that's kind of a bright green is the proposed WIC site in the Madison area. So this is our East Clinic, and again, the majority of the, let me point that out to you right there. You can see the majority of the East clients come from right around the clinic there, but if you look up here at the top, there's a huge cluster of clients that are coming from that Madison area. If, comparing it with the other maps that we've already seen, it almost looks like there's a clinic already in that location because there's so many people right around that bright orange dot right here. This is also one of the higher poverty levels in the Nashville area as well. It actually has some of the highest poverty there too. So this is where we're proposing to locate the clinic. And so what we're trying to do as a program is that we certainly want to get rid of any barriers that are kind of keeping people from being able to access the WIC services. And we need to engage the community stakeholders in this when we go about our planning, because we did run into some problems, and Teresa can certainly go over any more details that somebody might have. But the goal of this is we really want to improve population health, and we want to be sure we're improving health equity as well. So what we think are the key to getting this program to work well is really getting buy-in from all the people that are involved. Certainly, the USDA and the state health department. Again, USDA is the federal grant. It's administered through the state, and we provide it in Nashville. The Metro Council is very important in these type of decisions because they kind of guide a lot of these things, and of course getting the community. So what's going to be our marketing plan to get all these people kind of on the same pages? Of course, certainly there's some advantages for the community financially. WIC brings about $14 million into Nashville each year where participants redeem their vouchers. And it's about about $1.4 million a month. So for like Kroger's and Publix and Walmart and the businesses where people go to get their vouchers redeemed, it's a huge income for them. And then of course the other advantage, if we can be located more out where the clients live, it eliminates some of those transportation barriers, and hopefully it'll make it a little bit easier for clients to access those services. So again, kind of using this health equity framework, where does the WIC program fit into this framework? These are some of the questions that we'd kind of like to answer today. How do we develop a coalition around getting the community engaged to do this? And how do we design this new WIC facility and incorporate this for the whole community as well? So these are kind of the questions we're hoping to answer. So I'll just leave that up for now. So.
Yeah, come join us, Chris, if you will. So we are glad that the rest of you are here. We're about to start talking to each other, because the notion of this is that we want to model. I don't know if we have any musicians in the room. Tanae, I think, is a clarinetist, at least through the 8th grade. Was that right?
Actually, 11th grade.
11th grade. Okay, so all, years and years of experience. But the notion of what? And he's a wedding singer. Great. I'm a pianist. We have all sorts of music people here. But in a master class, what happens is that a expert musician comes in and works with a single student to sort of walk them through working on a piece, and the rest of the people, you all, watch and see that happen. So what we're going to do is our conversation is going to be with Chris and Teresa, with our experts. We're glad you're here, but we're not going to do this in a formal presentation style. We want this to be a conversation here. As we move through, there'll be an opportunity for the rest of us to engage in questions and engage in the conversation. But so we're going to be talking straight to you guys. This is not the ground rules are we're not putting you on a hot seat. We're not judging you. We're all kind of on the same team here. We want a better community. But there may be times where if one of us has a strong opinion about something and saying, I don't think you did that right, we're going to tell you. Okay, so that's important to be honest here. And I think that I think we want to be informed by what happened in Antioch, but I don't think we want to focus on that today. We spent a whole session thinking, okay, what went wrong? Now it's going to be, what do we need to do right to move forward here? Because there's a tremendous opportunity to continue to meet the health needs. Any questions about that? Okay, so let's think about from each of your perspectives, and feel free to weigh in as you need to, and we'll guide the conversation. How should the health department, how should Chris and Teresa go about identifying who cares about this? Who are the key stakeholders? And then we'll talk after that about how they might engage them. What are the messaging they might do? And then we'll talk about sort of what their next steps might be forward. But who wants to help them think through that?
I think, if you don't mind, if I could start, because a lot of times with clients that I work with, I mean, the main basis of where I created my firm was the fact of people continued to come and say, I have a problem, I need a marketing tactic, and they never really backed up and thought about who are we talking to. And oftentimes the client thinks that you're only talking to that person that will buy your product. So backing up and thinking about who are our multiple audiences. So we've got obviously those who will be utilizing the center. We've got those who live surrounding them that won't be utilizing it, but it will now be in their community. And then on the flip side, we've got those that will really, Kroger, Publix, whomever, will reap the benefits of those coming in. So I think the first thing is making sure that we take a step back and look at all people that can be effective, whether positively or negatively, and making sure that there's a marketing strategy for each of those people. And I'm not familiar with, I just have the highlights of what happened with the Antioch area. But from what I understand, maybe the only audience that was considered was possibly those that would be utilizing it, and that's when kind of others spoke up. So that's a big thing that I feel like that we battle, no matter what industry you're in or what product or service you're selling, is that you miss that step. You want to jump ahead and think about, what is our message and how do we communicate, because this person needs this, and we forget about the others.
For me, the maps identifying that the Madison area, I guess Northeast Nashville, you had so many consumers out there. That was amazing to me when I saw that. And I agree with you, Samantha, about engaging all of the stakeholders. I'm 100%. But I guess my question to you, not knowing what you all have done thus far, is the location accessible through public transportation? And also, are the people that you're trying to serve, do we understand their transportation needs? So will they be coming on the bus? The reason I ask is because I think it was said before, Nashville does not have the greatest public transportation system yet. And right now, everything goes to downtown and to the hubs. So I'm almost thinking that for some folks, it's going to be easier to get downtown and get the services as opposed to get downtown, transfer, then go out. Yeah. So and I'm wondering, so what conversations have you had with individuals that are going to be riding the bus, and then also MTA?
Well, what we've actually thought about is actually locating this facility at the Madison Transfer Facility, okay, which is now the Metro facility out there. There's a couple advantages there. It is a Metro-owned facility, so as far as us entering into a long-term lease with a rental property or things like that, it kind of eliminates that barrier for us as an organization and a business. But again, it is right on the bus line. Okay. And I think that the goal for that area is to have more services available for clients right there at that facility. Okay. So that's kind of our initial plan. Now, of course, that's our plan, mm-hmm, and it gets back to your concern about the marketing strategy. That's maybe not the plan for everybody else, or the community may say, well, we would rather have this located here for whatever reason. And
I would just ask. I would just sort of. I don't know how many of us actually take the bus on a regular basis. I would just sort of get with those individuals, those consumers, and say, what works for you. And even so far as going on a bus ride with them, or either on yourself, just sort of tracing, just to sort of make sure, okay, I get what this looks like, I get what this means for our consumer. I think that would be really great, and that would be something to market right, to get buy-in from the community that we're doing everything that we need to do to make sure that we
yeah. So getting
input
the
from
perspectives
stakeholders.
from the potential clients, not
Right.
only sort of, do you want this, but what would it look like if we did it at this site? If it's at a site that is doesn't feel safe, for example, that
Right.
might, even if it's a really convenient site, that might influence it. Who else? I think one great lesson from the Antioch experience was the politicians had a huge role in sort of rolling that out. And so, are there other people in this particular neighborhood in North Nashville, Madison area that, or what are roles or other sort of public leaders or other things that might be affected by this? Any perspective? Yeah, go ahead.
The Madison Chamber is huge. Have you all had a chance to reach out to them? I think that would be a huge starting point politically. And of course, the city council member or members that would, because then they sort of understand what the other concerns of the other stakeholders are, sort of piggybacking on what Samantha said.
So Mike, if let's say we're talking about WIC in Madison right now, but what strategy or what lessons can the health department learn from your experience on how to go about decisions like this? Because there's great, I think Tanya said some wonderful suggestions, but any advice for them about this particular issue, but then even more broadly?
I think so. We work with neighborhood organizations, and when I say that, everybody usually nods as though they know what I'm talking about, but when you get down to it, people get confused. This is not a homeowners association where they try to tell you what color you can paint your house. It is not a neighborhood watch where people are just running around looking for crime. It's a neighborhood association, a voluntary thing where people come together in a neighborhood and say, I want to improve this neighborhood. I want to help deal with some of the problems. And one thing I've really learned about neighborhood groups and neighborhood residents is that when you don't consult them for things, they get really upset. And if you think about it in this way, many neighborhood groups are working very, very hard to affect decisions being made about their community and decisions that they want made in a particular way to improve the community. So if a brand new decision shows up that somebody else has made that they feel threatens, whether it really does or not, but if they feel it threatens what they're trying to do, you really get at cross purposes. I want to go back to what you said about multiple audiences. I think we really need to consider that. There are a lot of different audiences that you want to impact, but you don't want to do it just by telling them stuff. You want to do it by asking them stuff. And in fact, I would go so far as to say, don't talk to them about WIC. Talk to them instead about their community and about how are children doing in your community. And maybe have some discussion groups so you have church pastors, community leaders, business people, longtime residents sitting down with some WIC participants and let them talk together about children. Don't walk in and say, okay, how do we locate this WIC place? I think sometimes we get those things divorced. What it reminds me of is that in one neighborhood I've worked with, in this neighborhood group, there's this one woman that was pounding the table about, we have to have a curfew for the youth. We have to have a curfew for the youth. And finally I said, why? And she said, oh, my house was broken into 3 weeks ago and they think it might have been youth. Okay, so see what she did? She seized on the answer without identifying the problem. And that worries me about the WIC thing. I don't want to let us seize on the answer without engaging others in identifying the problem. Maybe one of the big problems is the food stamp office isn't located out there. Do you see what I'm saying? To look at it in a larger setting. Right now, our agency is working with the Vanderbilt-Meharry Alliance to do some focus groups about health-related things throughout the city. But nobody asked us to work with those folks in a continuing manner to help them solve the problem. You see, so our research is divorced from implementation, and I think that's wrong. I think you're stronger. Like if you went back to the slide that showed the nice trees, one of the things is powerlessness that creates the tree that has no leaves on it. It's the lack of social structures, the lack of people being engaged with each other. And I think this is one way to do that. I also just wanted to throw in quickly, I'm not going to defend the actions of every neighborhood group any more than a medical professional would defend the actions of every medical professional. Neighborhood groups can make good decisions and bad decisions. Some of you might know the name Saul Alinsky. He was kind of the granddaddy of community organizing and began in the 30s. In the 30s, he organized the Back of the Yards Council in Chicago, which was incredible. It was across ethnic lines, not especially racial lines, but across ethnic lines. He had communist labor leaders working with anti-communist Catholic bishops, And he did a great thing there. But after he left that organization, it organized to keep African Americans out of the neighborhood. So I'm just saying that, you know, we've got to find some way that we help people focus what they're interested in, what they care about, but not predetermine the issues.
Something that you added to my marketing thought to that was something we can't forget with marketing is it's more about listening than it is speaking. And with social media, websites, digital marketing, it's getting even more prevalent. But listening to their needs more than speaking at them is probably the biggest takeaway. So team that with the business strategy, with the marketing strategy. My question to you guys is there a firm deadline, or do you have a timeline strategic approach of the listening phase? I mean, I would encourage, don't push, don't make something happen before it needs to, and truly listen for the next 6+ months if there's the time to do that.
Unfortunately, there is a timeline budget-wise.
But that can be included in the plan. I guess the discussion so far has said add these other pieces in the beginning. And I don't want to repeat that, but I totally support what's been said before. So maybe I'll take it a little bit further. One of the things that you will find with the listening phase is that, like you were suggesting, Mike, there are other things that community probably has been wanting that could be potentially incorporated into the WIC project.
That's perfect.
So often a community doesn't have a place to meet. You think, well, there are a lot of churches in the community. People can meet in those churches, but people really don't cross their parochial lines, So sometimes, a facility like a WIC office can provide a meeting space for people or can support some other problem that people are thinking about. So it's partly listening and it's partly going into it, being prepared to flex a little bit and give a little bit to what they consider important. Then the other thing is that it sounds like even now we know in this conversation, but usually other people in town have been talking to neighborhoods about other problems, and those are colleagues of yours. So Neighborhoods Resource Center may already be doing something up there, or Planned Parenthood may be doing something up there, or some other agency. So that's also kind of breaking out of the public health department group to make sure you get to the meetings where you talk to who else is working up there and what they've been finding out and what they've been learning to help you be ready.
Even on the nonprofit side of, thinking of United Way and where their partner centers are, and, anyone that's out in the community reaching the core audience is, we all don't want to lose sight of, the core audience is who we want to help. But hopefully those that we continue to talk about that surround that, the numerous audiences, they all want to help that group as well.
And I also like trying to think of, I think you mentioned it when you began, trying to think of who is it, when we say stakeholder, who is it that could benefit from this? I mean, you mentioned the grocery stores. I think that's a great thing. That could be a great place to start, strangely enough.
Health fairs or something in their parking lots. I mean, they will so get behind that. You're bringing people there.
And there are churches out there that have like food pantries, or that, they're offering help. It would benefit them to be able to have a WIC center there. But once again, I want to make sure that we're asking the broad questions like Barbara was saying. And I'll give you just one quick example of that. A number of years ago, MDHA, our housing and development agency here in Nashville, got funding to put a lot of scattered site public housing duplexes around. It was going to be great because it would be technically public housing, but they would be scattered through the neighborhood, so there wouldn't be a stigma about it. Well, in their wisdom, they decided to concentrate it all in one neighborhood. And that neighborhood rebelled, and it was a big stink because they already had a lot of public housing. Well, one neighborhood I was working with in South Nashville said, we will take some. And you know why? They were interested in housing, but they also had a lot of vacant lots that were overgrown, and they could not get the city to do something about it. So that helped solve some of their problems too. And I think that's kind of what you were talking about. If we listen to people in Madison or wherever it is, and listen with a broad enough ear, then maybe we can hear some of the other concerns that might be met through the WIC Center.
Again, I'm not sure how much groundwork you all have already done, but from the PowerPoint presentation, it seems like you are putting a lot of thought process into this. My question is, to what extent have you engaged the planning department, Metro Planning Department? In North Nashville, when we had a couple years ago, we had the North Nashville planning meetings all around North Nashville, so people got a chance to sort of go in with little dots and just sort of talk about what they wanted to see in their community. I wonder when the last plan for that area was, and just sort of what was the feedback from the community. I think that is a huge resource because then they also have the contact information for the stakeholders to start those dialogue, that conversation. So, and you can just see if you're on the right track, or just see if you need to think a little bit broader, like what Barbara suggested.
So these are great suggestions. So we've identified that it's a lot of it is listening, so that, instead of, and Chris, in reflecting back some of the language you used when you were showing your map, which was really, I think, great, you said that led us to the decision to place the WIC Center here. So if you were to say that in a community group, they would say, well, why the heck are you wasting my time if you've already decided you're going to put it here?
Yeah.
And if I look at the capital budget for Metro, I see, boom, put the WIC Center in the North Nashville Metro Transfer Center. So you can't move forward with doing something until you have the dollars to do it. So I think logistically you recognize that, but just being very sensitive to the language that you use in even talking with these folks about this. And so that's just a reflection back. But we talked about sort of the potential clients and neighbors and the Madison Chamber and the city council representative and the neighborhood association and pastors, other groups that are active in the area. So right now we've at this point identified about 27 months of work for Chris and Teresa and their staff at the same time that they're doing a gazillion other things. Right. The other sort of important framework around this, and this is what sort of public health people face, is that, we all face time constraints, but they put the budget proposal in, there's an approval for that budget. If they don't spend that by September 30th, 2014, right? And we might want to have you define for us what spending means, whether it's the first shovel in the ground or whether it's the ribbon cutting. If they don't spend that money goes away. And so their ability to meet that important public health need is gone. And so I think that we want to find a way, we'd like your advice on how do you, within government or other sort of programmatic constraints, move forward in a way that's still true to the spirit of this, but also meets the sort of the real, what are the hard timelines? So what's the hardest timeline here? What has to be done by September 30th before these dollars disappear?
The money has to be allocated.
Okay.
A purchase order has to be written, but the money does not have to be spent.
So it means you have to have a contract for someone to go put the light bulbs in and put the walls up. Or whatever.
Well, the Metro Council probably, you're saying the Metro Council would have to allocate,
No, it comes from the federal government. The money does.
Okay.
It's not Metro dollars.
Sorry.
So for it to be signed off on by September 30th, when would you have to have the proposal into the federal government then?
We would have to have the proposal in we could have the proposal in any time, because we have to have their approval before we can begin. Even though the dollars are there, that does not mean the money's been allocated. We have received the money, but then they have to have approval from the federal government that this is a project that they want to fund.
So that approval has to be in place by September 30th. When do you have to, what's the latest date you could go to the feds and say, do you approve our project? That's our hard deadline that this listening and planning needs to be guided by.
We have to have approval from the federal government, and the first shovel has to go into the ground by September 30.
Okay. So then, I'm going to keep pushing. When do you because we need to know to help guide you, when does the listening stop, and when do you have to have a final plan? So could you go September 28th?
No.
27th?
No. I would say by July 1.
Okay, so July 1. So we have between November 13th, I guess, whatever today is, November 13th and July 1st. Is that a fair, would you agree with that? So Samantha says you got plenty of time.
I agree.
Tanae's,
Yeah.
Barbara's
I'm excited about
Barbara's
that.
a
I
little
was
more
like,
skeptical.
is it February
She's a
or
little worried.
January?
No, I mean,
But
because-
talk about that. So
I mean,
how
it's-
does they do that in that time constraint?
It's really about having conversations. And I mean, people know people. And I mean, the bottom line is that you're providing a resource in this community, which you have the numbers, you have the data that supports that, right? So it's just about building goodwill and just sort of just having so I asked a friend of mine before I came to this meeting who lives in Madison. I said, well, I'm going to this meeting and they're talking about building a WIC clinic in Madison. What are your thoughts? And she said, well, and she educated homeowner. She said, well, what? I don't have a problem with it. I just want to make sure that it looks nice. So that's beginning to get that buy-in. And then someone else chimed in and said, well, what? The one in South Nashville that I know about is really, really nice. It's well set up, and it seems like it's a really good resource for that community. So those conversations can sort of snowball and just get you going. But you just have to sort of network and dialogue. But I think you have plenty of time.
Well, I think another thing we struggled with a little bit is kind of where do you start?
Yeah.
Do you start with the council? Do you start with the community? Really, where is the best place to begin the whole process? And that's like, we kind of create a little project charter for how we think we need to go about and, get all the players involved. But again, is it better to start with the council person? Is it better to start with the community? Because obviously if the community wants it, the council person's going to be behind it. But, if they have a sense that, maybe I don't think my community wants that. So
I would start with the council person because they know who those stakeholders are. They know who are sort of going to be the more outspoken grassroots citizens. They know who are the developers in that area. They know the chamber. I mean, I think you go there to sort of say, listen, I need your help in terms of getting the names and just sort of getting the lay of the land for that community.
And the Antioch council person led the charge against this.
Mm-hmm.
And so how do they phrase their question? Mike, you may, or you may, what's the question to ask the council person to avoid a sudden wall and a mob sort of descending upon the public health center to say, no way? Because I think that was a really a surprising thing. So what's the question?
Can I inject just something? To begin with Antioch, we engaged the council person. We had lunches in our boardroom at the health department with him. And we had his buy-in 100%. But it was after, I don't know when the tide turned, but we began with him at the Antioch with the council person. And
you tried that strategy before.
Yeah, and we even rode around the Antioch area with him in our vehicle, and looking at sites and talking about. So we probably had at least 8 meetings, contacts with him before we ever went past that point.
One of the things about these kinds of problems is that there really isn't a cookie cutter response, that you have political forces and personality forces and all kinds of stuff that'll be different in different places. But I think looking back at the Antioch experience probably would be a first step. One of the things we haven't talked about, I don't know if it existed in that case, but was there a feeling that putting a WIC office there somehow embraced illegal immigration? Because we never want to talk about race and we never want to talk about these kinds of things, but maybe there was, and I'm not suggesting anything about how you deal with it except that you start by trying to figure that out and then imagine or talk with people about, would that also be going on in Madison? And it might or might not be about people who are undocumented. It might be about people who are a different race or a different religion, whatever. But, always recognize that these kinds of things exist in our culture and we never want to talk about them, and we have all kinds of code words and code issues we use to pretend that those aren't it. But I would definitely take a look at that, because that's the sort of thing the council member is definitely not going to raise. That would be so politically incorrect for a political, that you're not going to hear that there. But you need to know that that might be what's going on in his or her head, and he or she knows that might be.
So let's bring it to this question, this community. Tanae, you live there, you know a little bit about it.
I don't live out in Madison.
But you live in North Nashville, but yeah.
But yeah, I mean, I think the situations are very similar, and the immigration issue is huge. So, I mean, sort of taking a step back from the hats that you sort of wear as Metro employees, how would you, I mean, if that were your community and you were fighting for this resource, what would you do in order to make it happen? I think you still have to have that conversation with the city council person, because ultimately you need their buy-in, right? But maybe you don't get their the goal isn't to get their buy-in initially. The goal is just to try to get the lay of the land to see who the major players are in the area.
Yeah.
I think you have the conversation with Metro Police Department, because they're on the ground. They're talking, they know who the heads of the neighborhood watches are. Those are the voters. Those are the people that are going to be in your corner to help advocate for this type of an entity in the community if it's framed the right way and they understand the value it can bring. So we talked about planning, we talked about city council, we talked about Metro Police. You already have the numbers from the health department, the neighborhood associations, right? The Latino civic organizations, community-based organizations, trying to get their perspective. So it's a lot of conversations that you have to have, but conversations are not necessarily hour-long meetings, right? So you don't have to have all these meetings where you have to have lunches and things of that nature. You really just have to get up, roll up your sleeves and sort of say, okay, I'm going to be a person who lives in Madison now for the next 6 months and try to figure out from that perspective.
Tell us more about that. So what do you mean? So because I think that if I were approaching this, I might say, okay, well, I need to have him in for lunch, and I need to drive around and do that kind of thing and get him to completion. But when you say it's less than an hour, what is it? What is it? A phone call? Is it an in-person visit? Is it a question? Either of you?
I know from my experience in North Nashville, whether it be advocating for TennCare and having those conversations that we had a few years ago about the TennCare changes, or voting rights, or just we were talking about gentrification, the forum that NAACP had a couple of weeks ago for North Nashville. It really is. For me, from my perspective, sort of popping into Harper's Restaurant and sort of seeing people that I've seen before that are regulars, the retired individuals who sort of know everything there is to know about the community, all the gossip and all the politics. It's just sort of building those relationships. So where are those I guess, community restaurants that are in that area? Sort of where do the I know, and we have like 50 Ford here at Nashville General. Where do the retired individuals congregate? In North Nashville, they do it at the Northwest Y or Hatley Park. It's sort of going in and having those conversations and getting to know people to sort of understand, okay, these are the people that I need to make sure I have made contact with in order to not receive pushback on hearing the idea of the WIC clinic. So, so I mean, it really is just sort of fun socializing, if you would, and getting to know people and sort of meeting them where they are. And I think, Barbara, you said it before, or maybe Mike, it's also about understanding the other issues that they have in their community, and then you saying, you know what, I will be that facilitator to the other Metro entity for you on your behalf. I will get that contact person who you need to talk to make that, to at least help address your problems or your concerns. So it just is community engagement one-on-one, and it's relationship building. And you can't be a Metro entity coming in and forcing it on folks. You just have to sort of, I guess, let them know that you're trying to do better for their community.
Well, I think that's important around community engagement, because again, it's something that I struggle with is I see no downside for WIC.
Mm-hmm.
If you look from an evidence-based, look at the research, the outcomes are there. There's really, I don't see WIC bringing down property values or anything like that in the community. And some of those things that maybe somebody else would bring to the table, say, well, there goes the neighborhood or whatever because we have a WIC facility at.
I completely agree
Wow.
with you. I disagree.
I gotta respond.
But that's, in a way, that's actually not good. Because there are other things that I believe in 100% and I don't see any downside. And as soon as I get into a discussion about those with other people, I irritate them.
Yeah.
So by being a public health person and being a devoted public health person, you're actually in some cases the worst spokesperson.
Yeah.
You know,
That's a very good point.
because there are. So one thing I was going to suggest in the conversations that Tanae is talking about is there may be partners for public health out there who could be promoting this instead of you, who do see a little bit of the downside, you know.
I was going to
Because
recommend
sometimes an
build some
advocate's
sort
the
of
worst person.
not a board, but a committee of individuals, you know, use November, December, maybe some of January to have those conversations, build that committee and say, look, we want to take this, we need ears to help us listen. The two of you can't do it on your own. And I think that if you have those brand ambassadors that you build in stage one or phase one that are taking that word out and getting that feedback for you, then you're not, because I'm the same way. I'm so passionate about whatever I support, I'm 1,000%. And I can come across as I'm trying to make you believe what I believe. You know, so I think that if we have those that say, well, here's the downside and here's the upside, and make it a conversation, then you can have, you know, public hearings or public meetings where you have a group that's running it that's not even an actual Metro employee, where they feel like, okay, everyone's listening to me, we're going to record this and send it back to them, or whatever the case. I think that's a really a great point. That would be my first marketing strategy, is build the brand ambassador group and let them do some of the on-the-ground work for you. But
I think you got to be careful what you're asking for here, because if they're asking about WIC, let me go back to what I was saying before.
I think it's asking about everything. It's what does the community
I think
want?
it's asking about everything, and then towards the end of the meeting, you're asking more about children. Because what Antioch was worried about, because I got calls from people in Antioch, and what Madison's worried about, I've gotten calls from Madison too, is they feel like their neighborhood is running down. Now, for some people, that's property values, and I get nauseated when I hear people talking about that. You know, but what I'm mainly talking about is their commitment to that neighborhood, that area. You know, if they see it kind of going down and down and down, and then there's a proposal to put something there that they may think would attract very low-income people to the area. But see, if you flip that over, if you say, let's talk about children and their outcomes, what does the data show that's been happening in Madison? You know, if you can show that all that's connected to nutrition, then you say, well, what are our options for nutrition? Somebody may say, well, let's start a community garden. Well, that's a great idea. It's not going to have the impact that we want. Here's this WIC program. You know, does that make sense? So you framed it in a different manner. You're not saying I'm a government official coming in to place something in your neighborhood and I'd like your approval. Instead, you're saying I want to hear what you think about your neighborhood and what you think would improve it, especially around youth and children.
Yeah. So the home value argument, that's huge, and I'm going to give you an example of something that happened in this North Nashville recently. Woodbine Community Organization owns a lot of property in North Nashville. I'm sure other parts of the city, South Nashville. And what they're doing is that they're building, or either they're using the units that they own in North Nashville, and they're putting individuals in there that I can't think of that.
Halfway houses?
Halfway houses, thank you. And so there is a burden, an overburden in North Nashville of halfway houses. So on my street alone, there are 4 halfway houses. I live on 11th Avenue between Clay and Buchanan. That is a huge burden for my street. On the next street over, there's 2. On the next street this way, there's about 3. So we had and that's just my area, right? So we had a meeting at the Neighborhood Resource Center. We invited Woodbine, we invited MDHA. We tried to figure out what we can do because the perception is that the halfway houses here in our neighborhood are making it less attractive for other people to come in and move in and become homeowners. Woodbine's answer to our concern was, well, this is the best opportunity for us because it's on the bus route. Right, and we want our residents to be able to access the bus route. but they didn't come in and engage us. And it's not that we don't want any halfway houses, we just don't want to be overburdened with the halfway houses. Because if push comes to shove, if there's a fire or something of that nature, the people that live in that particular house probably are not going to have the resources to save themselves. So it needs to be a community input. So if we don't know who they are, if we haven't been engaged, then it's going to make our neighborhood more resentful. So the bottom line, it is about money. It is about money for individuals that live there. And I think we would be remiss if we just sort of ignore that part, because WIC is stigmatizing, and until we as individuals understand or turn around that stigma or come to terms that it really is the greater good, you're going to have to deal with the politics of it all. And I think that's what Antioch was about home values being lowered.
Well, one piece of data that you presented was that 50% of American women, I think, are eligible, or 50% of Nashville women are eligible. That's probably not widely known. So you might want to think about those income levels in terms of your marketing. That's one thing. And then this is a question about data. Is there any information about whether having a WIC facility in a community actually does depress anything in the neighborhood? Because if there's any information about that, you need to be able to share it so that somebody else doesn't uncover it.
Exactly.
If you can Google it and find it, you want to get to it first before someone else does, and they come waving it in your face.
Or ask the planning department to help with that.
Yeah.
That's one less thing you have to do. If you ask them to sort of, hey, we need this information, can you help pull that data?
So Samantha, because we want to give time for the audience to ask questions. So we've talked about sort of a phase one, which is sort of thinking about who all the key stakeholders are, recognizing that Chris and Teresa may not be able to get to all of them, and so they might identify brand ambassadors who ask some broad questions about children's health, charged with helping understand about nutrition for infants and children and what are possible solutions. Then, okay, so that gets us to January. We still have a July 1st stop date. What else needs to happen in February, March, April, May, and June?
I think the first phase, look at it as discovery. So you're listening, you're building your group, you've got your ears out there and you're listening. The second phase, you come back in my opinion, you would then develop the message. What are the positives that we're taking to the groups? Obviously in the discovery phase, you're outlining the audiences. So we've talked about those who can help us either find information or sell. And then you're defining who are we talking to. So the next phase is, after discovery, messaging. So build the message for all the numerous audiences that you're speaking to. I always build the message before I build the marketing plan, because you want to know what you're saying. Then let's determine the vehicles to get it to each of those groups. So it might be grassroots marketing efforts to those who will utilize WIC. It might be social media to those who are parts of the neighborhood that you need you need to be able to tell that mass audience, this is what we're doing, this is the steps we took to get here. We've listened. If we didn't hear you, here's your chance to let us know. So then go into the messaging. The third phase is develop that marketing plan. So what are those tactics? So discovery, listen. The second is message, develop that message for the multiple audiences. And then the third, build that marketing plan for tactically, how do we get on the ground? Then you go into implementation. So hopefully when you're sending that proposal in July and you're saying, we've heard, we know, here's how we're going to get to them, and this is all a perfect world, there'll be hiccups and hills, then you're implementing. Then you're getting that community excited and ready, hopefully, for this opening. And then what surrounds the opening, and then it doesn't even end there, it's how do we keep the message that is there and drive the traffic to the location once it opens. So it's a continuous process of listening and then telling the world, telling those that need to know. So I think you can break it down in those
One thing
ways.
I'd add to what you said is I don't like the idea of determining the message and then going out and trying to beat people over the head with it.
No.
And I don't think that's exactly what you were saying.
No,
but
not at all.
If there's some way to do the listening and then to bring the people you listen to together, so that you're bringing those folks together to be kind of a steering committee or something. And once again, I would not make it about WIC. I'd make it about something broader, about children's health or about good outcomes for children in school. I don't know, but something like that.
Yeah.
And then those folks can help you hold other meetings. It's a little bit like your ambassador thing, but I've been to too many meetings where a public official stands up and wants input from the public. well, whose meeting is it? It's obviously the public official's meeting, you know? But if instead you held a community meeting and somebody stood up and said, well, I'm the pastor of such and such church over here, you know, and we've been real concerned about youth and about children in the neighborhood, and somebody else stands up and says, yes, I've lived here for 30 years and I'm really interested in what happens with children, so that they're helping you run the meeting.
Yeah, you
In other
never
words,
stop
you're-
listening. Mine
yeah.
was the 30-second, well, probably I do 60-second answers. Elevator speech of
That's good.
what's the breakdown?
That's good.
You
I do
never
escalator
stop
speeches,
listening.
I think.
My elevator speeches are to the top of the Empire
Yeah.
State Building.
You know
They're
what
not.
this is, though? I mean, I think on the community end, we're sort of sending you in the direction of real partnerships at the community, and you're coming from a funding
Right.
world where you write a proposal, you wait months, you get a response, then you go and you build it and you make it happen. Those don't always work together that well. So public health has to kind of be walking that very difficult path all the time.
Even earlier in proposal development, potentially sort of saying, you know, even it might strengthen your proposal if you say we've created a partnership around youth issues in these neighborhoods, and
Right.
they're
Here's what
completely
we're
in
learning.
support of this. Here's what we're learning, and a WIC center is one strategy to meet that.
Right.
So that's a sort of a future lessons for future things. This is excellent. I think we want to take a little bit of time to open up. Leah, I think you were going to facilitate some questions from others in the room while we have this great group, because this is helpful. This is really what we were hoping, that we would give some specific answer for Chris and Teresa and their team, but then also for the rest of us in the room a chance to think through, well, how do we do this? And that's a great segue into that about in the future, even before you write the proposal. Thanks, Barbara.
So hopefully for the people in the room, you've enjoyed kind of sitting in on this studio process. And I know that there's been useful conversation and helpful thoughts that have gone across the table. But at this time, we'd really like to open up the floor to see if there are any comments or questions from our observers. So just raise your hand if you.
And I think it's okay for it to be about this issue or something
Sure,
you observed.
absolutely,
And about
absolutely.
sort of a broad thing that you might find useful, or you have some experts here who might help you with your issue.
Okay, yes, sir.
You know, I always hear about the stigma of WIC. And when I saw the chart, the graph that Chris showed, it really showed a family of four, $42,000 income. To me, that doesn't seem like that seems kind of normal, in Nashville. And I heard, Mike, you mentioned one of the people who called and were concerned referenced low income.
Mm-hmm.
Is it a matter of just getting and helping and that being part of the marketing to get out the numbers to say, look, this is not all low income. This is people who are living right next door to you, and they might just need a little help. I mean, is that part of the message that needs to be out there?
Most certainly.
And again, that's been our perception. I mean, a lot of the people on WIC are nurses and teachers and professional people, students going to school at the time of their life when they just need some extra help.
Yeah.
And so we do not see this as a lower income.
But the public perception is
But
that
again,
it is.
there's a different perception in the public, and so we try to do marketing to get away from that perception. So.
I
Well,
think
one thing
that's
that would be
a really
interesting too is if you wind up creating this little committee out there in Madison, is to try to get some of those nurses
Yes,
and
yeah.
some of those other people on the committee so they can talk personally about their own experience with
Yeah.
WIC.
I think I'm glad you brought that up because a couple of examples. I worked with the United Way on developing for VITA. People don't realize they can get free tax preparation, and I think the number is 52,000 it's literally, you would think it's someone that makes 20,000 or below and barely getting by, and literally there's people right out of college or that. It's educating that this is available to you. Why don't you take advantage of it? The other flip side is if you've never been affected with it and you haven't heard that conversation or seen that marketing, then you're just blind to it until you see you're going to put this in my community.
Right.
The only reason I knew what WIC was is my brother and his wife, when they had my niece 9 years ago, they were barely getting by, and we were helping, but she went and my mom went and did the paperwork and educated her on knowing she needed that milk and cheese and nutritional items with a child. So I wouldn't have known what that was. And when Leslie called me and said, the word WIC, well, I immediately knew because of my niece. I mean, so there's case studies, there's conversations, there's people that would be that quote unquote brand ambassador that has been affected by it in some form or fashion, and it's all about educating.
But unfortunately, I don't think you have the timeline to accommodate that mass community education that it'll take to sort of decrease the stigma about WIC.
I don't think you'll completely get rid of it, but I would.
Right. But I think people are going to hear WIC and they're going to react, right? They're just going to say, okay, it's just I'm scared because this is not something that I am familiar with, that I understand, and I'm not sure if I want it in my community. So to the extent, how can you just start chipping away and building relationships and talking about, I keep going back to what Barbara said before, it's not just about WIC, it's about the other issues of concern. And I think it's almost like a bargaining chip, right?
I completely agree with that.
Yeah,
I just think at the core it goes back to it's going to be a WIC center. So I think it's good to get to when you have those groups together and you are, at the end or whenever it happens, when you're getting to that point of discussing, well, is a WIC center an option? People need to be educated because they'll turn their ear and I'm not going to listen anymore.
Right.
And if someone in the group says, well, hey, did you realize that a family of 4 is $43,000?
Or if someone in the group says, I'm on WIC.
Or I'm on it, exactly.
Sometimes
those personal stories would be huge.
I was going to say, sometimes in neighborhood groups, you have homeowners that say, all those renters in the neighborhood, they're so awful. But if you drag a couple of renters to the next meeting, just having people there, it changes the way that they think about it. It's less easy to demonize or stereotype people.
I think we had one other question, Dr. Kim, or comment?
Well, the comment is about the messaging. If it's WIC that has the stigma to it, but what WIC is the supplemental nutrition program, and you were talking about if we really market towards, well, what about the children? Well, this is providing nutrition for children. If it can be marketed in that way and kind of like leave WIC out till the very end.
Yeah.
Because we're still talking about the same issue, but a different dynamic. But the question is, so that this kind of fine line between bringing recommendations to the community, we have the data, we have this space, it all kind of makes sense in the world of public health. But where is that fine line between bringing the recommendations to the community and asking the community for the recommendations? When you have that short timeline and you want to be respectful to what the community needs, but you still have this data and this need, and if the two never merge, then we end up with Antioch again. So how do you marry that fine line in a way that's most productive for both sides?
Well, I think this isn't easy, but I think, we have to, as a community, start talking about poverty and helping people understand, just keep talking, and help people understand that we're talking about things that are very complicated, and that there are people who are not in poverty but who need help, and there are people who are hardworking, whose kids are healthier if they have access to milk, if they're encouraged to breastfeed, etc. But we don't talk about those things. I don't know that you can do that within the timeline of a grant. But as a community, we have done a really bad job of talking about those issues. And
you got to start somewhere.
Yeah, and the health department would be a great place to start because we got experts here who see both sides of it.
Is there any other response? Okay, great.
For me, I think at this point in the game, I think that single slide with the proposed Madison Clinic and then all of the other consumers around it, I think that is going to be the message, the slide, the visual that sort of gets you through that conversation, that maybe will begin to turn the tide with some of the stakeholders. I think if you have that everywhere you go, a card just saying, this is the need, I think that would resonate with folks because we talk about WIC right now in this conversation, this part of the conversation sort of abstractly, but if you were to put that slide up there, I think that would sort of help remind us that these are real individuals. And I think at this point in the game, you sort of need some sort of visual like that to sort of stay on people's minds. And that needs to be all over the news when they talk about, okay, is this another Antioch? Well, it's another Antioch, sort of, because the need is there, where I don't remember seeing any type of audiovisual like that with the Antioch discussion. And that needs to be what's in the media and on everyone's mind when you talk about it. If you can't get the personal stories, because that's going to be time consuming.
Following that line of thought, in addition to just the map showing where the WIC recipients are, could we have a map that shows either census data, or I know you all have birth and...
I had more information, but I was trying to keep this to 10.
Well, the place I'm going to this is help people discover it themselves, be able to show we have low educational attainment, if that's it, and nutrition is a really big part of that. Or I know you all have birth and death data where you can show where mothers that what the birth weight was. You can show what the educational level of the mother. There may be some of that kind of data that you can show that is really the backdrop for choosing to say, yes, we need a WIC facility. Does that make sense?
Yeah, it does.
And also understand that it's not this, you don't have to have this huge marketing budget. I mean, there are so many ways to get the word out on the ground where literally you're utilizing word of mouth, you're utilizing media relations, that you're utilizing those brand ambassadors that you create to tell the story.
If you could get a brand ambassador who was a realtor, who could talk about, sort of hit the issues. I want to be able to sell my house for more than I bought it. And
let's make this community better, and you will be.
Somebody who will have that kind of credibility, as opposed to some of us.
Or somebody that lives near an existing WIC facility.
Yeah.
A resident that sees it and knows it, and that it hasn't brought bad things. I think people listen to their peers. Yeah. So if you have a resident in Madison talking to a resident from another area where there is a WIC facility, I think that helps a lot. You all were asking, how do you get this done in this length of time? And I would suggest that you find 10 people, I'm just picking that out of the air, that can go and make visits to people and develop a long list of maybe 100 folks that you want to see to start with. And it could be nurses in public health clinics, it could be teachers, it could be social workers, it could be pastors, all those people we've already mentioned, and do the short meeting that she was talking about, not the 2-hour lunch, but the 30-minute visit, because people will appreciate that, for one thing. And try to figure out some of the broad things that they're interested in and what the specific things about children might be. And at the very last question, say, would you like to hear what other people said to these questions? And if they say yes, then you invite them to a meeting like in March. So for example, January and February, you could do these small meetings. If you found people that were very interested and excited, you could say, who else do you know that's interested in this? Could you help me hold a small meeting of 5 people? But that kind of growing, developing of relationships. And shoot for a larger meeting like in March. Where you look at all of these different things. I also like what Tanae was saying about get some other metro agencies involved, get the schools involved with you, or planning, but so that when other needs come up, those folks can address them, and you're not totally responsible for everything.
Excellent suggestion. If there aren't any pressing questions, then I think I'll turn it back over to Dr. Canoe just to tie up the highlights from the session.
Thank you very much. I'm going to eventually have to say some thank yous, but I will end with that after the highlights. I think that we've had a very wonderful conversation this morning. And some of the things I heard actually include community engagement. Now, sometimes it goes by different names. But I think it's very important that whatever you do, especially in this business of conducting WIC activities, that it's very important for us to engage and listen to the people that we serve. And just if you permit me just 2 minutes, we always have examples of when this is not done very well. I'd like to share with you the case of a World Bank funded program in a community, which they thought was lacking a good source of protein. Well, they did some needs assessment, except that maybe they didn't do it holistically. They decided that they would help these people to raise pigs and have a piggery. Except that they didn't find out that a lot of the people who lived in this community are Muslims. And of course, you know where I'm going with this. Muslims do not eat pork or pork products. And of course, needless to say that the project was a waste. We've had several approaches that you've suggested in doing what the WIC people are supposed to do. The listening phase, I like a whole lot. And I know sometimes when we go to these communities, we use focus groups and several other things. I'm sure we also know about the Delphi group process. I don't know how many people use it, but I think it's a wonderful approach to take. And you mentioned the point, remind me your name again, please.
Barbara.
Yes, Barbara mentioned the very important point about learning other things in the process of engaging other than just what you go in there to learn about. And I think that's very important. And the Delphi group process, I think, will provide that opportunity where the community members will tell you not only about the problem, but they will also help you to rank them and see which one they should actually pay attention to. I also had, Mike, you mentioned the very important topic of framing. It's very important. Sometimes the way you present a problem or a solution will make people say, we're going to use this. But sometimes people will say, no, we don't even want to have any conversation about this. So I think framing is a very, very important thing. You mentioned the important topic about how do you even enter a community? And I like the point about engaging the councilmen. Every community has its own gatekeepers. And I think it's very important, first of all, to really identify who those people are so that you can start a very good conversation. Those are some of the things I had. You know, we of course, if we have more time, we can talk about that. Now, before I say my thank yous, I am reminded to tell you that in case you are not able to ask your question because of time, we do have index cards, and we will appreciate that you can ask those questions and we'll get them to the experts to talk about this. I want to acknowledge Dr. Paul, who is in the room, the director of the health department, for continuing, and his team, of course, for continuing to support this effort. And I'm sure that you can agree with me that this is really very enlightening. Dr. Celia Larson, you've always been there in terms of trying to organize this effort. Without people like you, Leslie Bone, it wouldn't happen, or at least not the way that we've seen it happen. I have to come to the wonderful moderator, Dr. Bill, and your wonderful group of panelists. Thank you very much for a job very well done. And of course, all the members of the audience, thank you very much. And I will end with the wonderful cameraman. You've always been with us. And I think that's a wonderful job that you continue to do for this community. Thank you all very much and have a wonderful day.